new pathway in the guidelines about supporting patients into hospital and support for the families and carers. This is to help improve the care needs of people with learning disabilities. There is evidence that there's a lot of health needs which are unmet.
People with a learning disability and/or autism have the same rights as anybody else to make decisions about their lives, including matters of life and death. Each year there are 1,200 avoidable deaths of people with a learning disability. This equates to 21 per month or 3 per day. On average, people with a learning disability die 27 years sooner than the general population. Men with a learning disability die 22 years sooner than a man without a learning disability, and a woman with a learning disability dies 27 years sooner than a woman without a learning disability. With the most common causes being identified as cancer, sepsis, constipation,
respiratory conditions, epilepsy. A lot of these deaths could have been avoided if the care had been there. So I think these guidelines and the pathway that is in place will help improve that. It's going to allow parents, support workers to go into hospital with the patient.
As the council, we have worked collaboratively with Northumbria Healthcare Trust and the Learning Disability Care Forum to put this guidance in place.
This guidance has been put in place for North Tyneside patients, and what it means is when a patient has a care and support plan where they have a reasonable adjustment, which will include carer support, that their carer is able to come into hospital with them when they come in.
The local authority and Northumbria Healthcare Trust have agreed funding procedures.
So the agreement is that when a patient comes in, the first 48 hours of their care will be funded by North Tyneside Council, and the remaining time of their care will be funded by Northumbria Healthcare Trust. And I think it's really important for families and carers that they know that the patient coming in, that they don't have to worry about that funding, that the care will go on regardless, and the local authority, Northumbria Healthcare Trust, will work collaboratively to ensure that funding.
It's important to support a person with a learning disability to come into hospital to make sure they have equal access to the health care with a high standard of care. This includes reasonable adjustments and preventing diagnostic overshadowing. Reasonable adjustments are about adapting our practice to ensure we are fully meeting the needs of a patient. This can be around communication aids, earlier appointments, quiet at times, anything that we feel the patient needs to ensure that they are accessing care. Diagnostic overshadowing is when we put behaviours or certain conditions down to a person's learning disability. It's important that we step away from diagnostic overshadowing and see the whole person. The DIS-5 allows ward staff to know that that person who has been admitted has a learning disability, but it also alerts the learning disability liaison nurse to contact the ward and ensure reasonable adjustments are put in place if needed. And we have very good links with the community teams, so it enables us to also contact them to just maybe advise that the patient's in hospital or to gain more background knowledge on the patient.
This guidance is particularly for people with a learning disability who already have an identified need for a carer.
The level of support we would provide from the learning disability liaison team would be dependent on the care and support needs of the individual.
The staff need to listen to the parents and the carers who are in with the patient and listen to any information that they've got with regards to any changes in the patient's condition. Within North Tyneside, everyone is usually offered a hospital passport, and these can be available before the person goes into hospital, so they're already filled in with lots of important information about the person. If the person hasn't got one, staff on the wards can actually offer the hospital passport. However, having that carer with the patient is just vital to pick on any changes or anything that's been missed with regard to that patient's care, and that information can then be passed on to the staff relevant who's taking care for the patient.
For us as family carers, this will make a huge difference. It'll give a lot of reassurance, and it's lovely to know that we can be with our family members throughout the hospital stay if necessary, to interpret the behaviours and to pass on information. It'll make a big difference for the prevention of unnecessary deaths.
I think with this guidance we do have to mention COVID-19. It's particularly pertinent at this point. Just to say, this won't impact on the guidance going forward at all. It won't impact on the patient care for the person with a learning disability, but what it will mean is that staff are having to follow COVID safe guidelines at the moment in the hospital trust. So it will be care delivered in a safe COVID way with appropriate PPE and infection control guidelines.
If the scenario was my son was turned up in hospital for whatever reason, we as a family will be really, really anxious anyway. It will be much better for us in the future to know that somebody else is going to take care. There's a process to follow. Things are being done for the right reasons, and this guidance will give us that reassurance, which in turn will relax us, and in turn will relax him, and hopefully whatever's wrong with him will be put right as speedily as possible, and the experience will be a more comfortable one with this guidance behind us.